So without further ado, thanks again for joining Citizens Committee for Children for this webinar on New York City's digital divide. My name is Jack Mullen. I'm a research associate at CCC, and I'm co-presenting today with Alice Buffkin, who's Director of Policy for Child and Adolescent Health. We really appreciate that so many of you have taken the time out of your day to learn more about this topic. And if this is the first time you've heard of CCC, just a brief introduction. Citizens Committee for Children is a nonprofit, nonpartisan organization that informs and mobilizes New Yorkers to make the city a better place for children. For 75 years, CCC has refined an approach to child advocacy that combines research and data analysis, civic and community engagement, and policy and advocacy campaigns. And we hope that today's presentation on the digital divide is a testament to this work. So today, we'll be examining internet access and inequity among New York City's children and families. The photo on the cover slide here is actually an aerial shot of downtown Manhattan almost 8 years ago. You may recall amidst a blackout during Hurricane Sandy. Now that was a very different crisis than the one the city is currently experiencing, but in a similar manner, it was an unexpected shock that exposed deeply rooted inequities and widespread vulnerabilities across the city. The coronavirus pandemic has thrust many parts of our lives now into the digital realm, and this transition has put into plain view a broad inequality of resources which leave many families and children on the wrong side of this divide. So as we consider recovery and release efforts going forward, digital equity is one component, but really a critical component that needs to be addressed to improve the well-being of all communities going forward. This presentation follows from a brief that CCC published in late April on New York City's digital divide, and will follow a similar outline. First, I'll be going over the data on digital inequities, including the fact that more than 500,000 households in New York City lack internet access. In tandem with these data, Alice and I will share evidence and experiences from service providers as anti-poverty programs, behavioral health services, education, and a whole host of services have gone online. Finally, Alice will wrap up with a summary of the policy landscape and what CCC is advocating for, and what we hope, obviously, you will join us in advocating for to overcome the challenges of the digital divide. If you're also, I'll add, if you're a social media person, I believe CCC has been using the hashtag digital divide to speak to these issues on Facebook and Twitter and the like. So feel free to chime in on these platforms if anything you find is worth sharing. So before jumping into the statistics, some of you may wonder how CCC obtains and analyzes the data that we produce. For this project, I looked at data from two main sources. One is the American Community Survey, an annual questionnaire of 3.5 million US households that includes questions about household internet and devices. So these data help us answer questions about internet accessibility, the way that households are accessing it, whether it's through broadband or cellular data plans, and also to draw out some characteristics of those households that are lacking internet. The second source is from the Mayor's Office, the Office of the Chief Technology Officer, which reported data from the Federal Communications Commission, the FCC, on internet service providers at the local level. And as always, much of the data we report here is available for you to view, visualize, and download from CCC's public database at data.cccnewyork.org. So here's the key takeaway. At a time when the digital sphere is critical to so many aspects of life, approximately 500,000 New York City households are without internet access. That is no dial-up, no broadband, no satellite, and no cellular data plan. Just consider for a moment the last 3 months under stay-at-home orders and the difficulties that would arise if you were without internet during this period. So citywide, this 500,000 number accounts for 16% of all households, but we can see that in certain communities, in the map on the right here, more than 1 in 4 households lack internet. This is the case in Borough Park in Brooklyn, in the Lower East Side of Manhattan, and areas of the South Bronx like Mott Haven and Hunts Point. In recent years, the city has improved the overall rate of internet access. You'll see this 16% has gone down over the last few years, according to the chart on the right, but there remains so much progress to be made, especially among low-income households. So when we break down internet access by household income level, we find that in 2018, more than 1 in 3 households earning less than $20,000 annually were without internet, compared to just 5% of households making $75,000 or more. So these figures tell us a bit about those lacking internet. Another aspect of the digital landscape is the method through which households access internet. So they do have an internet connection. And one dimension of this that is increasingly common are cell-only households, or homes for which a cellular data plan is the only means of internet access. And this was the case for 385 homes, or 12% of all New York City households in 2018. Again, the map on the right illustrates where these households are concentrating. So you find that In some neighborhoods, it's as many as 1 in 5 households are cell only in areas like Flushing, Jamaica, Elmhurst, Corona, and Queens, as well as Williamsbridge and Bedford Park around those areas in the Bronx. Using a cellular data plan is not necessarily a problem for internet access, and in fact, it may be the most affordable or accessible option for many families. But of course, a household without broadband are much less likely to have a device like a laptop or an iPad to carry out remote work or learning from home. So we've considered households without internet and those that are cell only. And then this final aspect is, what about households that do have broadband? What about the quality and availability of internet services for those connected households? This is where the FCC data came in, and we mapped the share of competition among internet service providers, or ISPs, across NYC and New York City neighborhoods. Generally, 3 or more ISPs are considered necessary for optimum choice and quality of service to avoid a monopoly or a duopoly in the market. And while internet services are universally available in New York City, so that is every household has at least one provider available, some areas of the city have significantly limited choice. You'll see here in the map, Washington Heights and Northern Manhattan, as well as around University Heights and Co-op City in the Bronx. These areas have just one ISP available for broadband services. So this is obviously different than lacking internet entirely, but nevertheless presents its own obstacles if lack of a competition among providers is resulting in lower quality of internet services in these areas. So as I said, there are different dimensions to the digital divide. There are these nearly 400,000 households that rely solely on a cellular data plan. There's this 14%, or roughly 450 households with just one ISP or internet service provider available. And then there's the 500,000 households that lack internet altogether. I hope you can take these key figures away, but I'm going to take a moment now just to pause to see if there are any questions about the data or information presented before we dive into the landscape of service provision right now for families. And again, you can submit these questions through the Q&A or the chat feature. And while you may be writing or considering questions, I'll share just a few more characteristics of these households without internet. Because we found very significant differences by, for example, educational attainment, where 32% of households that are headed by someone without a high school degree are without internet. And this is compared to, if you look at households headed by someone with a college degree or greater, it's just 4%. And then along age lines, we see that nearly a third, 31% of households that are headed by an elderly New Yorker, that is someone aged 65 or older, so 1 in 3 of those lack internet. And finally, along lines of race ethnicity, 17% of Black-headed households and 16% of Latinx-headed households are without internet, compared to 11% of white-headed households and 9% of Asian-headed households. That's along all household types, but if we look specifically among children, so there are 150,000 children living in households without internet. And if we look at the race ethnicity of these children, there's actually a much greater share of white children living in households that lack internet, especially due to areas with large Hasidic populations like Borough Park, Williamsburg, and Bedford-Stuyvesant in Brooklyn. So currently I don't see any questions regarding these data, so I must have been super clear so far. So I'm going to proceed with the services landscape and hope you're following along. So I cited this figure. Again, I hope you take this one home. If nothing else, 500,000 households in New York City have no internet. Now, a household obviously is a housing unit that can host multiple individuals. So the estimate of the total individuals without internet is approximately 800,000 New Yorkers. Of that group without internet, hundreds of thousands are enrolled in safety net programs like food stamps, cash assistance, and Medicaid. You'll see the numbers here below. The greatest share of those without internet actually being 425,000 enrolled in Medicaid. So this means that the populations most in need of anti-poverty supports may be facing greater difficulties right now in accessing the needed services because of the digital divide. In recent months, the New York City Department of Social Services released new information on benefits. Among these changes, new clients do not need to provide proof for their Medicare application for the duration of the pandemic. Also, all active Medicaid cases will be extended and no cases will be closed for failure to renew or provide documentation due to digital barriers. And for those whose internet access is solely mediated through cellular data plans, the Human Resources Administration, HRA, has provided enrollment measures through its Access HRA online portal and app, and assistance is available by phone. However, we know there's a vast need for emergency food, medical, and cash assistance right now. It's really at a crisis level, and it puts an incredible amount of pressure on this updated online benefit system to handle the demand right now. So with that, I'm going to pass it on to Alice Buffkin, who will discuss other aspects of service provision in the context of the digital divide right now. Alice?
Thanks, Jack. So as Jack was talking about, we know that there are really few aspects of the lives of children and families in New York that aren't being impacted in some way by COVID-19. And one of those areas that we know is particularly important is mental health. Even before COVID-19, roughly half of children with behavioral health needs in the state weren't getting the services they needed. And now many are experiencing new traumas related to COVID-19, whether that's economic and housing loss, loss of loved ones, isolation, anxiety, and there's an even greater struggle to get them the services they need. So like in other areas, we've seen a big shift to telehealth services. And in some ways, this has really sped up the advances in teletherapy, helping get through a lot of red tape so services can reach more people. But there are a lot of challenges. Obviously, number one is that we have people who cannot access internet, cannot access these services because of the depth of the digital divide. And more fundamentally, a lot of services aren't lending themselves necessarily to being provided remotely and really require a great deal of thinking and innovation and flexibility. And of course, there's issues that we'll talk about throughout this presentation around challenges of privacy, of language barriers, of difficulty serving young children. And then plenty of services that will never be able to be provided online, such as immunizations. So these are all issues that the city and the state is grappling with, and we'll touch on some of these in the policy discussion. And then in the areas of school, obviously students throughout New York City are attending school remotely. The Department of Education has distributed 290,000 devices to children to assist them with remote learning. But we know that the challenges of remote learning go beyond whether or not a device is available. And we need to do additional work, not only to narrow the digital divide, but also to make sure that we are supporting students in every way we can to learn and to have their other needs met in their homes. The other component that city is focusing on is supporting regional enrichment centers, which you may have heard of. These are sites with DOE employees and community-based partners, and they provide childcare, remote learning, warm meals, activities for children of essential workers. And so we'll talk in a little bit about how some of those access to regional enrichment center or RECs can be expanded further. So this overview is really just touching on some of the host of different ways that the city, the state, and communities have adapted to COVID-19, but it's clear that more needs to be done to connect New Yorkers to the services they need. I'm going to talk largely about New York specific proposals, but I want to start with a discussion of some federal issues, because right now we really are living in a circumstance where there's a trickle-down effect, where the decisions made at the federal government dictate how much funding is available at the state level, which in turn dictates how much the city has available. There are a couple of proposals at the federal level that our national partners have been promoting. One of these is to dedicate at least $4 billion for an emergency connectivity fund. So what this would do would support funding for something known as the E-rate program, which is already in existence, and it helps schools and libraries afford telecommunications and internet services. So really trying to rely on an existing infrastructure to help students. And there's a bill, HR 6563, among others, that would attempt to get at this issue of an emergency connectivity fund. There's also the proposal to dedicate funding to during the crisis and following it for an emergency broadband benefit. And many of you may have been closely following the various federal packages that have been coming out. The HEROES Act is the most recent proposal for a fourth federal relief package it's been passed in the House, but has not been approved on the Senate side. Among the many issues included in it are a dedicated funding for an emergency broadband benefit. So again, while we really want to emphasize the importance of city and state level advocacy, we do know a lot of the resources that are available at the state are dependent on what our federal government does, and urge continued advocacy at the federal level as well. Overall, what these proposals are getting at is the issue that we have to increase access to broadband services, that we need to find, if families don't have broadband, we need to find ways to connect them to internet, whether that's through supporting data plans or mobile hotspots. And we need to have flexibility in how services are provided in recognition that we're in a new landscape. So if the federal government doesn't step in, it means that we need to continue working with the city and the state to fund connectivity, to fund internet access. Both the city and the state had a number of initiatives around trying to fund broadband and other internet connectivity. Like everything else, it's being impacted by COVID and by sort of some of the budgetary needs and budgetary cuts that are looming. But we need to continue to make the case that this is more than ever are we seeing the need to make sure that all families have access to the internet services that they need. Sorry. I want to move now to talking about some specific areas in New York. So focusing on education, on health, on child welfare, some of the different areas where we're seeing specific populations of children who are really needing additional support in order to access the services they need with their families. So in terms of remote learning, we know that, like with every other area, a top priority in sort of crisis mode is in making sure that children have in their hands a device that enables them to connect to the services that they need, to the educational supports that they need. So we have seen, as I mentioned, that the Department of Education has distributed 290,000 devices throughout New York City. There are estimates that that means that there may be around 10,000 students who have not yet received a device. So we still need to work to make sure that all of those students receive the devices they need. And the other challenge is that we know that the devices that have been issued, that are iPads, that were issued after schools went remote, they are on lockdown. So essentially they are providing, many of them are requiring that they only be used for educational purposes. And that really creates a challenge, because we know that that device can be a lifeline for a whole host of services, whether that's connecting to the safety net services, whether that's connecting with family, whether that's connecting with behavioral health supports. And so that's an issue that we need to look into, is how do we make sure that, for every device that's provided, it's able to maximize its use for a family. Another area of importance is the regional enrichment centers that I mentioned. So these are really important sites for parents children of essential workers who can go to RECs to receive childcare, receive remote learning. But we know that in New York, there are about 100,000 students who are homeless. And these are students who can find it particularly difficult to learn because of the circumstances they're in. A shelter or a hotel can be an extremely difficult setting for learning. If there are children of different ages, it can be hard to support them at the same time. There are enormous issues around privacy and concentration, not to mention the other basic needs that families are trying to meet at the same time that they're trying to deal with educational supports and childcare supports. So we, among many of our partners, are proposing that RECs be open to students in temporary housing. We also know it's important, another population that is facing a lot of challenges in this transition is students with disabilities. So in this transition to remote learning, it's really important that parents are actively engaged in the development of a remote learning plan and adjusting it based on students' needs as situations change, as parents and families adapt to remote learning. It's also important that the DOE continue conducting evaluations and tracking student progress to help make sure that students are receiving the support that they need. And then finally, we need to protect and support summer youth programs. So I'm sure many of you have been following that in New York City, we are essentially on the verge of slashing entirely some of our most critical summer and after school and youth support programs, in addition to a lot of broad-based educational cuts. These programs have really been vital for students' educational success. And they also help connect students to adults and peers outside of their household. They support social emotional learning. So supporting these programs is really necessary to fill in those gaps that families are experiencing as they're continuing to work remotely. And, yeah, thanks. So in terms of health and access to teletherapy, again, this is the common refrain that it's very difficult to get services if you don't have access to the actual devices and internet connectivity that's necessary. So really working on identifying those families who don't have broadband, who don't have access to internet, and getting them a device that they need. And that's, again, where it comes in. It's better that if we can provide one device that can be used for both educational supports and health and other areas, that's much better than having to, have one provider provide a device for one purpose and another for a different purpose. So, as I mentioned earlier, we really are seeing a rapid level of innovation and flexibility. We're speeding up this process of telehealth and teleservices in a way that we haven't seen before. And that's great. And we really do want to see that continue after things are beginning, to get improved in our city and our state. We also need to make sure that in that flexibility that providers are getting reimbursed for the work that they're doing. We really can't afford to have a network of providers that isn't sustainable during this period of crisis, drops out, and then we find that our network has been decimated because we weren't able to sustain the healthcare providers and the behavioral health providers that are so important for families. So we really need to look to innovation in ways that we can both reach families and also make sure that we're meeting their needs through telehealth and teleservices. And that brings us to the last point, which is we need to make sure that telehealth doesn't exacerbate existing inequities. So we know already that there are clear racial and socioeconomic disparities in access to healthcare and treatment in healthcare systems. And we need to be very careful that in this expansion of telehealth services that we don't exacerbate those. So that means making sure that language, different services available in different languages are available. That means making sure we have culturally responsive care that recognizes not everyone responds as well to telehealth services, that we have a whole host of different folks in the state and the city who need support in different ways. That we need to recognize that the healthcare system has often failed minority communities, and we need to commit to addressing that. And so really ultimately we want to make sure that we are identifying those areas where children and families have been left behind and making sure that they're being pulled in. And the final thing I'll say, is that we can't view telehealth and teletherapy as a silver bullet. We know that there are still plenty of services that must be provided in person, that not everyone can access telehealth services. So we need to continue to identify ways we can safely connect people to in-person services when that's the best alternative. So in terms of critical safety net services, as Jack spoke to, there's been a major transition to providing services, ability to access them online. But of course, not everyone will be able to access them online. We need other ways to increase education and outreach to families so that they know what's available. Normally, many of the normal modes of understanding what's available, like going in your communities, going and talking to neighborhoods and connecting in all sorts of different ways in libraries and all of their spaces, those aren't available in the same way. So it's really important that we increase education and outreach on benefits. And one I flag here in particular is pandemic EBT, mainly because we are just trying to get the word out on that as much as possible. And some of you may know this is a federal approval that we only received a couple of weeks ago. And essentially what it does is provide nutritional assistance to all children in New York who are receiving free or reduced price lunch. And that's about 2.1 million children statewide. And so what that means is in New York City, where every child is eligible for that, that means that every child will be getting $420 in nutritional benefits to help support their families, help support themselves. And that's something that very few people are aware of right now. And so that's an issue we in particular want to flag and support city and state efforts to increase education around pandemic EBT, but also the host of other initiatives that are available. Part of why this is so important is because benefits are changing so quickly, things are being added. We also have families who this may be new to them. This may be the first time if they lost their job, maybe their first time applying for unemployment insurance. It may be their first time needing SNAP. And so we need to really boost our outreach by phone, by other means to really connect people to the services they need. One of those programs is known as the Nutrition Outreach and Education Program, or NOEP, and it helps do outreach to underserved populations around the services they're eligible for. It's also important to support programs that use trusted community organizations to connect people to services. So that includes things like community health workers or the Access Health program here in New York City, which works with CBOs to provide culturally responsive information about healthcare services and healthcare rights. So another population that we know is particularly at risk is children and families in temporary housing, which I referenced earlier. So earlier in the presentation, I mentioned the importance of opening recs to students in temporary housing. We also need to explore teleservice models for families in commercial hotels. So right now, we know with families who are currently in hotels, those are really not good sites for having wraparound services, for having social workers, for having caseworkers that are individualized. So we need to explore innovative ways to connect these families via teleservices to support like social workers, to make sure that they are, not feeling isolated, that they are getting the wraparound services that they might be more likely to get in a shelter setting. And we also need to make sure there's reliable Wi-Fi connections, internet-ready computers and tablets for people in shelters. The Department of Education has been doing a pretty good job of getting devices out to students in temporary housing. So the devices themselves may not be as much of the issue as these issues around environment, around making sure that we can provide a supportive environment to learn and to thrive as possible. And then other children who we need to make sure that we're not leaving behind are children who are involved in the justice system. So we need to make sure, again, providing reliable technology, laptops, tablets, phones to youth so they can participate in remote learning and stay connected with their families, attorneys, and social workers. This is an area where there's still some uncertainty around what is occurring with students in the youth justice system. We need to do a lot more digging to make sure that these children aren't left behind and that they are having the connectivity support that they really need. And that includes improving equipment that's in court and detention facilities so that we can really support young people in having video contact. And that also means training for staff. And similarly, for youth who are in foster care, we need to make sure that they all have access to internet so they can have virtual visitations with families. And so again, wanting to make sure that we are not in our broad push to make sure that we have broad-based broadband, that we're increasing internet access overall, we need to be very careful of vulnerable populations who are at particular risk of not being supported in their needs for internet connectivity. And then the last issue I want to touch on is getting out the count for the census. So like many of you, CCC has been very active in trying to get an accurate count in the census. So as many folks are aware, the census is critically important, not just for funding from the federal government to making sure that it is matched to the population that we have. And right now, there's really been, never a more important time for us to make sure that we are maximizing the amount of funding we have to support these programs that are so essential to helping families recover and thrive in the face of COVID-19. We also need to make sure that our count is accurate in order that we have accurate congressional representation. So unfortunately, a lot of work had been done before this pandemic, but a lot of the most effective ways to get out the count are really in-person, sort of community-based efforts. And so there's really been having to be a shifting in strategy. New York City has done quite a bit of work to both prepare and to continue to do outreach, working with community-based organizations to reach out by phone and find other means of reaching out to families and to individuals to encourage them to fill out the census. And as you know, this is particularly important for children under 5, who are one of the most undercounted populations. Unfortunately, the state has not had the same level of commitment. Even though the state was appropriated a substantial amount of funding to help get out the count, we have not seen that funding adequately distributed to community-based organizations. So that's a top priority, is making sure that the state actually fulfills its commitment and recognizes the importance of supporting CBOs in getting out the word about the census. And also, we know that there are other means other than the online census. It's really essential that that people are able to fill it out online, but there are other ways via phone and paper mail that we can get out the word. And then the final piece is that eventually, when it is safe, we will really have to ramp up our efforts to support things like census ambassadors and one-on-one approaches to really help get out the count around the census. Luckily, the deadline has been extended, but we still have a lot of work to do to get to our goals.
Thanks, Alice. So if you're watching this and are in need of support or looking for resources or ways to support others, CCC has created a comprehensive page of resources for families and across all areas of life in the current crisis. I just wanted to flag this here. You can learn more at cccnewyork.org/COVID-19 resources. This covers the whole gamut that we've talked about today. For those interested in learning more, I'm going to drop 2 links in the chat box here. One is the original brief on CCC's blog from which this presentation is derived, and another is a link to some national findings that the Pew Research Center released on digital access and internet use amid COVID-19. I believe we're due to wrap up at 2 p.m., so we have still about 30 minutes remaining, and we're happy to take any questions and comments. If you have to go, as always, you're welcome to reach out to either of us, Alice or myself, by email, which you can find here on the slide. We really appreciate all of you taking the time to join us today. And with that, I think we'll open it up to questions and discussion. And yes, there is this question. I'll just clarify right away too. Is this going to be emailed to us? Yes, this recording will be emailed along with the slides in a follow-up email.
And I see we have a hand raised, so I'm going to go ahead and I think since we have plenty of time, let me go ahead and allow, I will answer you. Janae, are you on there? You just disappeared. Hold on. Okay, feel free to either type your response in the chat, or if you're online, there is a raise your hand option if you prefer to ask your question verbally. definitely give it a couple more minutes for people to respond and see if they have any questions. Okay, great. We got a question here from Nancy saying, what is the city council's response to this issue? So, I think that there has been a rapid reaction in some of the ways that this presentation is designed, which is really around specific populations of children and families who need access. So obviously, we want a broad-based investment in the infrastructure around the city and the state around broadband. But I think right now, like with everything else, the city and the state are a bit in crisis modes in terms of saying, what's the fastest way for us to get services to families and to children as quickly as possible? And so I think the first response, not just from the city council, but from the city broadly, has been the sort of quick move to get devices into the hands of students throughout the city. So I would say, there's been a broad base of city council responses. It would sort of depend on what issue area we're looking at. I think there is a real recognition that the digital divide is a challenge. I think it is often coming down to the sort of priorities around recognizing how many needs there are across the board. So the city council right now is in consideration of the budget. I mentioned that the executive budget that's been proposed has, substantial cuts to new services and education programs. So I would say that's a top area where the city council is absolutely on the same page of pushing back on those cuts in recognition that that's really only going to exacerbate a lot of the issues that the digital divide is causing for children in terms of remote learning, in terms of supports, in terms of their ability to connect to resources in the community. And so if you have a more specific question about which particular issues the city council is responding to, I could definitely address that. But I do want to use this as a link and actually, Laura, I'm not sure if you're able to speak, but we are actually right now doing a lot of advocacy around cuts to youth services and education programs. And so that's actually a way, if you're looking for a way to sort of advocate on this right now, that's a great thing to connect to if you're not already, is looking at the advocacy happening right now around restoring youth services.
Yes, thank you, Alice. I think I sent out an email to some folks on this call today about some social media actions, but when we send out the recording of this video to all of the attendees, we'll also share some links to take action.
Thanks, Laura. We also got a question about funding for NYCHA. So in New York City, actually, the mayor just recently asked for internet service providers to submit essentially a request for to essentially apply for funding to increase access in NYCHA facilities. So looking at things like internet costs, looking at mobile Wi-Fi hotspots. Right now, that's just a request for proposals. So I think a trend that we're really seeing at both the city and the state level, which you can see from the Governor's Broadband Commission that he pulled together, is they're really seeking sort of public-private partnerships in a lot of ways of trying to identify how can they maximize that in order to increase access. So there is definitely some additional attention to NYCHA facilities, but I think the actual plans have not been laid out to my knowledge. I think that there's efforts to try to get some innovative ideas on how to increase services there. I think as an organization, we would like to see all NYCHA facilities outfitted with, internet connectivity. I think that's something that we have obviously been supportive of well before this crisis. So, hopefully this will help speed up that process. But of course, there are challenges in terms of safely accessing facilities, given COVID-19 and wanting to be safe in terms of how that's approached.
I see there's a related question here too on the need to do more. We need to do more at the local level, but also looking forward for broadband as a national issue where the federal government can put more funding into broadband the same way it was done in bringing electricity to all in the 1930s. And we've alluded to this throughout the presentation. In New York City, there still are shortcomings in terms of broadband access for all, but there really is universal coverage, at least in one service provider per household. Of course, we'd like to see it expanded to make sure that no households are facing this monopoly or duopoly of services in certain areas of the city. But we know that broadband cannot be dismissed as something that's not important to New Yorkers or New York State broadly too, as Alice has discussed. When we think about trying to reach communities in rural parts of New York State, it's still important to ensure universal broadband coverage so that people who are on the margins of the state in terms of digital access can still receive that coverage. Now, that's why there are layers to this, because we also discussed we have to be able to juggle multiple things, and not just broadband, but also like making sure that policies are mobile friendly or cell friendly, because of the growing number of New Yorkers who are also accessing the internet through their cell phones. So we want to put our hands in multiple buckets and make sure that we're advocating for multiple things, but not just lose sight of, or not to focus solely on broadband coverage, and know that internet access is a multi-layered issue in New York City.
Yeah, and to add to what Jack is saying, you know, I think that with connecting via cell phones and other devices like that, you know, at least in the terms of, for instance, behavioral health, for some young people, that's really how they communicate with their friends. That's how they communicate with their families. And in some ways that can be a more comfortable way to communicate, whether it's texting more frequently, whether it's, you know, communicating in a way that is really familiar to them. So we do hear from some providers who say, in some ways, this is reaching them in a way that is really reaching their comfort zone. So we want to make sure that there's a recognition that flexibility and that innovation and adaptation to what happens and what's most comfortable and effective for each person. At the same time, we recognize for many people that isn't an effective way, and there does need to be sort of more of the potentially video interaction. And so it really is opening up space to have really unique conversations about what are the specific needs of individuals, and how do we create a system that can adjust to their needs as quickly as possible, and make sure that we are being supportive in a way that's not necessarily a one-size-fits-all for everyone. One last thing I'll say is that, and want to give folks another couple minutes to respond, but you know, there are a lot of conversations around, at the state level in particular, around how is telehealth working, how is access, how's broadband functioning throughout the state, and a lot of it is being driven by you know, folks like Google and folks who have really got the technological side of it. So it really is an important time for community members to weigh in and sort of make the case for what works for them. And often that is connecting with community-based organizations who are familiar with their own communities and know and are trusted. And so I think that as this conversation continues, it's important that it doesn't just stay high level. There is engagement from providers who are working directly with children and families who are seeing on the ground which ones are needing devices, which ones are really struggling with the new transition to teleservices, who are really losing out on some of the normal ways they had to connect to services. So I think a lot of work needs to be done in really understanding at a local level, what does it look like to be trying to make this transition, and what's the best way to address it? Because we are a big state, we do have a lot of different needs, and we need to make sure that we are not trying to you know, blanket the whole state with one solution, in particular because we know that some of these populations, like students in temporary housing or students in the youth justice system, we can't afford to leave them behind. So we need to be as careful and targeted as possible as we continue to develop solutions.
Okay, with that, I see there's no further questions at this time, so we're going to wrap up. And once again, thanks so much to everyone who joined us for this presentation. Please be sure to stay in touch with CCC, not just in terms of the digital divide, but in terms of a lot of the issues we're pressing for going forward, including funding youth this summer and many more campaigns to come. So thanks again for joining us, and enjoy the rest of your week.